Good afternoon, students. So, in the previous lecture of the orthopedic, we was studied about the fractures, and from the today's lecture, we will study the further topic of the fracture. In that, first one is the complication of the fractures. Complication of fractures include the many topics like first one that is introduction, then acute respiratory distress syndrome, Volkmann's ischemia or compartmental syndrome, non-union, avascular necrosis, traumatic myositis, ossificate, malunion. Other important complication of the fractures, they deep vein thrombosis and pulmonary embolism, injury to the blood vessels, injury to the nerves, complications peculiar to open fractures, shock, gas gangrene, tetanus, and crushing. So, the introduction of the complication of the fracture include first one that is fracture is a disturbing event, more so if it develops a complication. So, fracture is a disturbing event and it develops morely complication. The complication could be immediate or delayed. So the complication could be immediate or delayed. Immediate complications are life-threatening and delayed complications are more moderate. Some complications develop at the time of injury and are beyond the control of the surgeon. So they need to be accurately diagnosed and treated. Whenever a surgeon encounters a case of fracture, he should look beyond the fracture and try to detect complication if any. The following are the common complications. So, fracture is a disturbing event. The complication may be immediate or may be delayed. Immediate complications are life-threatening and delayed complications are not. But some complications develop at the time of the injury and they are not controlled of by the surgeon. So they need to be accurately diagnosed and treated. Whenever surgeon encounters a case of fracture, he, he should look beyond the fracture and try to detect the complication if any. So the following are the complications of the fracture. First one is the ARDS, that is acute respiratory distress syndrome. Synonymous is the fat embolism. Acute respiratory distress syndrome, that is ARDS, is defined as a post-traumatic distress syndrome occurring within the 72 hours of the skeletal trauma. So, after the 72 hours of the skeletal trauma, there is post-traumatic distress, which is called as a ARDS, that is acute respiratory distress syndrome. It indicates the presence of fat globules, that is palmitin, and stearine in children and olein in adults within the lung parenchyma and peripheral circulation after a long bone fracture. So, ARDS it indicates the presence of fat globules, palmitin, within the lung parenchyma and peripheral circulation after long bone fracture. It usually manifests within 24 to 48 hours but sometimes may be delayed for several days. So, when the fracture occurs within 24 to 48 hours, the complication is occur, but sometimes it may be delayed. It is dreaded complication and often associated with multiple fractures, major bone fractures, pelvic fractures, multi-system injuries like chest and abdomen, and head injury. So ARDS is a dangerous complication with the multiple fractures, pelvic, multi-system injury, and the head injury. It is seen in 10 to 45% cases of multiple fracture and is an important cause of morbidity and mortality. That is 11 in a multiple fracture and in multi-system injury. So, when the fracture is present within the 24 to 48 hours, there is a ARDS is present along with that, or it may be delayed, but it is seen in 10 to 45% cases of multiple fractures. When there is a case of the multiple fracture, in 10 to 45% cases, ARDS is seen. And it is very important for morbidity and mortality. In 11% people, there is a mortality rate seen in ARDS in the case of multiple fractures and multi-system injuries. So this is a diagram of the petechial rashes. Like these are the hallmark of fat embolism syndrome. So it is seen in eyes also. Then second is the Wolfman's ischemia or compartmental syndrome. The Mubarak defined compartmental syndrome as an elevation of interstitial pressure in a closed osseofacial compartment that result in microvascular compromise and may cause irreversible damage to the content of the space. So, when there is an elevation of interstitial pressure in a closed osseofacial compartment, so that result in microvascular compromise and may cause irreversible damage to the content of the space. Then sides are anteriorly and the posterior compartment of the leg. Second is the ulnar compartment of the forearm. Third is the buttocks, shoulder, hand, feet, arm, and lumbar paraspinous muscles are relatively rare sites. So when we see sites in the compartmental syndrome after the fracture is that anterior and the posterior compartment of the leg, ulnar compartment of the foot. These are the main sites. And the buttock, shoulder, hand, foot, arm, lumbar muscle are relatively rare. Then the compartmental syndrome of the forearm. This is one of the most dreaded complications in orthopedics and ranges from mild ischemia to severe gangrene. Early recognition and prompt remedial measure is the key to successful countering of the problem. So this is an orthopedic injury. Compartmental syndrome of forearm is dreaded complication in ortho and it is a orthopedic emergency which ranges from mild ischemia to severe gangrene. And early recognition and prompt remedial measures is required to countering of this problem. So, it is an ischemic necrosis of the structure contained within the polar compartment of the foot. When there is a ischemia of necrosis of structure of the volar compartment of forearm, then this is called as a compartmental syndrome of the forearm. So, this is a diagram of DIC of forearm. This is the clinical photo and this is a radiograph of the VIS. That is Wolfman compartmental syndrome. Then, now meaning. Difference between delayed union and non-union is of degree. In delayed union, healing has not advanced at the average rate for location and the type of the fractures. But healing can still take place. The limb is immobilized or longer period. In non-union, there is a evidence to show clinically and radiologically that healing has ceased and union is improbable and needs surgery. Final status of non-union is pseudoarthrosis. Non-union is said to be established when a minimum of 9 months has elapsed since the injury and the fracture shows no radiological visible progressive sign of healing continuously for 3 months. So, the difference between the delayed union and non-union is of degree. The delayed union healing has not advanced at the average rate of location, and the type of the fracture is more important. But healing can still take place if the limb is immobilized for a longer period. So when there is a immobilization is done, then for a long period, then healing can be takes place in such a cases. And in non-union, there is a clinically and radiologically shows that healing has ceased. So healing is not occur and union is improbable. So there is a not complete healing and there is an improper union of a bone. So it needs a surgery. That is a non-union. So final status of the non-union is pseudoarthrosis. Non-union is said to be established when a minimum of 9 months has elapsed and since the injury and the fracture show no radiological visible progressive signs and of healing continuously for 3 months. Then this is a X-ray that is radiograph showing infected non-union of a tibia and fibula. So this is a X-ray of showing non-infected non-union of tibia and fibula. So where we can see an improper healing of a bone, so it needs a surgery. Then avascular necrosis. Avascular necrosis is an rare but severe complication of certain fracture and it occurs when the blood supply to a segment of a bone is affected. So avascular necrosis means what? There is a hamper blood supply to the segment of the bone. So there is a no proper blood supply to the segment of the bone in certain fractures which leads to the avascular necrosis. So due to the peculiar blood supply, avascular necrosis is common in the three bones. That is first one is the talus. This is diagram A showing the talus and its blood supply. In the diagram B showing this bone scaphoid and its blood supply. Then third one that is the neck of the femur with its blood supply. So these are the common necrosis, common avascular necrosis cases which are seen in the three bones that is talus, scaphoid and the neck of the femur. So due to the peculiar blood supply, avascular necrosis is common in these three bones, talus, scaphoid and neck of the femur. So this is important in clinical point of view and in the oral examination. Then traumatic myositis ossification. It is a reactive lesion occurring in soft tissue and at the time in the bone periosteum. So, traumatic myositis ossificans is relative lesion which is occurring in soft tissue and at a time in bone periosteum. It is characterized by fibrous, osseous, and cartilaginous proliferation of the subperiosteal hematoma, and this is later followed by a metaplastic changes. So, radiograph showing myositis ossificans in the elbow joint. So, this is the X-ray of elbow which shows the myositis ossificans in elbow joint. So, it is characterized by fibrous, osseous, cartilaginous proliferation of subperiosteal hematoma, and this is later followed by metaplastic changes. Then, next complication is a malunion. When fracture fragment heal in an abnormal position, then it is called as a malunion. So, when there is a fracture fragment heal an abnormal position, then this is called as a malunion. In it can pose the following problem that it may cause cosmetically unsightly deformity. It may cause alteration in posture and balance in lower limb fracture. It may cause shortening. It may interfere with joint function and alter weight bearing mechanism that may lead to premature osteoarthritis, that is OA, of the hip and knee joint. So this is a diagram of the malunion of the long bone of the tibia will cause deformity which is seen in the diagram A, and in the diagram we can see a shortening. So this is a type of the malunion. So it can cause the following problem, that is it may cause cosmetically unsightly deformity. So this is shortening is, and this is a deformity is a cosmetically not good to see, and it may cause alteration in posture. So in the deformity there is alteration in posture and balance in the lower limb fracture, and it may cause shortness. So it may interfere with joint function and alter weight bearing mechanism may lead to premature OA of the hip and knee joint. Then this is a X-ray, that is radiograph showing the malunited fracture of both the bones of the foot. So here there is a fracture, malunited fracture of both the bones of the foot. That is in diagram A. In this area, we can see a malunion, and in these areas. Then the other important complications of the fractures are as follows. In that first is a deep vein thrombosis and pulmonary embolism. Deep vein thrombosis, that is DVT, is an important complication seen after a fracture of the spine, pelvis, femur, tibia, etc. Ruptures trial of venous stasis, vascular damage, and hypercoagulability has described the pathogenesis. So DVT is an important complication seen after spine, pelvis, femur and tibia fracture. So there are virtuous triad is very important, that is venous stasis, vascular damage and hypercoagulability. Virtuous trial is commonly asked in an oral examination that what is about the virtuous trial. So it is a venous stasis, vascular damage and hypercoagulability. It is seen in the DVT, that is deep vein thrombosis. Injuries to the blood vessels. Blood vessels in a close proximity to the bones are injured during the fractures and dislocation. So when there is a fracture or dislocation, there is an injury to the blood vessels. So in this diagram, we can see the injury to the brachial vessels can occur due to the displaced supracondylar fracture of the humerus. So here is a humerus and here is a displaced supracondylar fracture of humerus which lead to the injury to the brachial vessel. Then injury to the nerves. 40% of the bone and joint injuries are associated with the peripheral nerve lesion. For example, when in diagram A, as you see, there is a radial nerve injury can occur in the fracture of shaft of the humerus. So this is a humerus and due to the fracture of shaft of humerus, there is a radial nerve injury. In the diagram B, there is a posterior dislocation of the hip joint can damage a sciatica nerve. So when there is a posterior dislocation of the hip joint which leads to the sciatica nerve damage. So 40% of bones and joint injury are associated with the peripheral nerve lesion. Then complications peculiar to the open fractures. In that first one is a shock. In fractures of major long bone, pelvic fracture, multisystem injuries following RTA, that is road traffic accident, etc., severe loss of blood may seriously threaten the life of a victim, and there is a delay and apathy in attending a hypovolemic shock could prove fatal. The shocking fact that is a look for the classical features are first, sunken fiber, when tongue is a pale and dry, pale look, BP is low, there is a cold and clammy skin, nose is also cold, peripheral pulses are feeble or absent, and drowsiness or unconsciousness with the sweating. So when there is a fracture of the major long bone, pelvic fracture or multisystem injury or RTA, when there is a severe loss of the blood which seriously threaten the life of the patient. So, which lead to the delay and apathy in attending the hypovolemic shock could be fatal. So, it requires an emergency treatment. And the classical features of the shock are these are very important, that is sunken eyeball, pale and dry tongue, look is pale, the BP is low, skin and nose is cold and clammy, peripheral pulse is feeble and absent, and there is a drowsiness or unconsciousness with the sweat. Then gas gangrene. Gas gangrene, this is an uncommon infection of the superficial and deep fascia following a severe trauma which resulting in necrotizing vessels. And the offending organism in the most of these situations is Clostridium, that is about 30%. And the presence of gas in these tissues implies that due to the anaerobic bacterial metabolism, insoluble gases like hydrogen, nitrogen, and methane are produced. And the vital facts are gas gangrene feature shows skin discoloration, skin belt, there is a drainage of thin, watery, grayish, foul-smelling fluid from the wound, subcutaneous crepitus, Then through the wound exudation, skin is tense, white and cool with the increased pulse rate, temperature more or less normal. There is a profound shock and toxemia, and finally death. So, gas gangrene is an uncommon infection of superficial and deep fascia, which following a severe trauma resulting in necrotizing process. So, it is occurred due to the Clostridium. There is the presence of a gas in the tissue implies that due to the anaerobic bacterial metabolism, insoluble gases like hydrogen, nitrogen, and methane are produced. So there is a production of the gas in the necrosed tissues, which is called as the gas gangrene. And the features are seen in that there is a skin discoloration, skin bell, there is a drainage of thin, watery, grayish, foul-smelling fluid from the wound. Subcutaneous crepitus, then through the exudation, skin is tense, white and cool, pulse rate increase, temperature more or less normal, then there is a profound shock and toxemia, and finally death. Then last complication of the fracture is tetanus. Tetanus is a fatal disease caused by Clostridium tetanus and can occur in a patient with superficial wound, deep wound, or even in no demonstrable wound. So clinical presentation shows a full-blown tetanus patient present with the following features. There is a restlessness and headache, then spasm of the neck and pharyngeal muscle, locked jaw. In later stages, there is a orthotonus, opisthotonus, etc. occur. Generalized toxic convulsion can occur. These are triggered easily by the external stimuli like light, sound, breath, etc. and prone for the fractures due to the fall. So they supervene after the 2 weeks to the helpless victim and mortality rate is 60%. So tetanus is a fatal disease by the Clostridium tetanus and can occur in a patient with superficial wound or deep wound or even in demonstrable wound. Then a full-blown tetanus patient shows that there is a restlessness, headache, spasm of the neck and pharynx muscle. Then there is a locked jaw. In later stage, there is orthotonus, opisthotonus. Generalized toxic convulsion can occur, and these are triggered easily by external stimuli like light, sound, breeze, and prone for the fracture due to the fall. So develop the supervein after 2 weeks to helpless victim, that is mortality rate is 60% in the tetanus. So this is also an important complication of the fracture. Then the next topic is the fractures in special situations. Fracture in the special situations are firstly fractures in children, epiphyseal injuries, pathological fractures, and fatigue or stress fracture. Fractures in a children shows that they are different from fractures in adults for the following reason. Complete fractures are rare due to thick periosteal sleeve and greater elasticity. For the same reason, the mention above buckles, that is, torus fracture, and green stick fractures are more common. So, in the children, there are torus fracture and green stick fracture are common. Fracture displacement are relatively less common. Fractures bleeding is also less. These emergent fractures are more common because bone gives away much earlier than the ligament. Disruption of epiphyseal slate are relatively more common. Fracture displacement are relatively less common. Fracture bleeding is also less. Avulsion fractures are more common because bone gives away much earlier than the ligament. Disruption of epiphyseal plate are relatively more common because they form the weak portion of a bone in the children and account for nearly one third of all childhood fracture. A pediatric fracture unite first. Differential periosteal activity causes better remodeling, which is more likely in the younger children, and the nearer the fracture to the epiphyseal plate, and third, that is, if the deformity is angulated in the plane of the joint movement. So, all the tissues in the children not only heal well but rapidly too, that is, joint stiffness in bugbear in adults and rarely happen in children. Incidence shows that fracture account for about 10 to 25% of all injuries in children and common between 10 to 14 years of the age. So the boys account for 62% of all the cases and fractures distal end of the forearm is the most common skeletal injury in the children contributing 25% of all fractures in the in etiology is that falls are the most predominant cause in children. Traffic accidents, especially bicycle accidents, account for 25% of the cases. So, in the children fracture, there is a torus fracture and green stick fracture are more common, and fracture displacement is relatively less common. Fracture bleeding is also less. There is a avulsion fractures are more common because bone gives away much earlier than the ligament. Then disruption of epiphyseal plate are relatively common because they form the weakest portion of the bone and its pediatric fracture is unite faster and Differential periosteal activity causes remodeling better and more likely in the younger children. Fracture near to the epiphyseal plate and when the deformity is angulated in the plane of the joint movement. Then all the tissues in the children are not only heal well but rapidly too, that is joint stiffness or bugbear in adults, and it rarely happens in children. So fracture account 10 to 25% of all injury in childhood, common between 11 to 14 year of age, and boys account for 62% in August. Fractures distal end and forearm is the most common skeletal injury in children, contributing 25% of all the fractures in them. So, if the causes are, it is due to fall, mostly seen in the children, traffic accident, especially bicycles accident, and account for 12% of cases. Sporting activities contribute 21%. Birth fracture in that the clavicle is the most commonly injured bone during the birth, which account for 40 to 50% of all birth injuries. So in the birth injury, 50%, around 50% injury of birth commonly in that scene, that is a clavicle fracture, followed by a brachial plexus injury, usually during instrumental rotation of the vertex, the humerus injured during the breech delivery, and the femur is that order. So when there is a fracture of the clavicle, which lead to the brachial plexus injury, and it is due to the usually seen during the instrumental rotation of the vertex, and the humerus, that is which is injured during the breech delivery. When there is a breech presentation, then in breech presentation normal delivery, which leads to the humerus injury, and the femur